Good afternoon to everyone. I am Elango, nursing principal from KAPV Government Medical College, Trichy. I would like to teach you on this online. I'm happy about that. This will be more helpful for the diploma nursing students, basic BSc nursing students, and post BSc nursing students. This is actually third video class. This is a continuation of second video. The second video is actually about the IV administration. Let's go to the topic now. You can see in the PPT in front of you. This shows the selection of peripheral IV sites. Selection of peripheral IV sites is most tedious to the nursing field. So site to avoid is actually edematous extremities. Some edematous extremities should not be selected for IV administration. An arm with a weak or traumatized or paralyzed hands also should not be selected for the IV administration. And also I can say that the hands with a fistula, AV fistula or shunt, you should not select these hands for the IV administration. And also if the hand is infected or with anything, gas gangrene or something else or compartment syndrome, you should not select the hand. My kind advice for the nursing students and nursing staff to select the IV site, particularly they should select the left hand rather than selecting right hand, because the right hand is the dominant hand for the most of them. So better select left hand. And that too, I am giving strong instruction to the nurses not to start the IV line in the joints, in the elbow joints or in the wrist joint should be avoided to start the IV site. Okay, better you start in the forearm. That will be more helpful for the student, helpful for the patient. All right, next see the second slide. There's a selection of peripheral IV sites. This you can see the dorsum of hands for the selection, and here you can see the selection of veins. This third slide you can see, this is actually to take the blade, the elbow joint to take the blade, not to start the IV line. Okay, yes. This is the infected and gangrenited hand. It should not select for the IV fluid administration. Okay. Yeah, this is about, you can see the administration responsibility of the nurses. Okay, before starting the IV fluid administration, the nurse having a lot of responsibility. They should check the IV solution. They should assess the complete assessment of the patient and identify the client condition and wash your hands thoroughly. Use sterile techniques to start the IV fluids. Okay, you should clean the skin area and select the vein and prepare everything near by the bed and start the IV fluids according to the prescription. And this change of venipuncture site every 48 to 72 hours. That means 2 to 3 days. Okay, change the IV dressings every 72 hours when the dressing is wet or contaminated or as specified by the agency policy. Then change the IV tubing every 24 hours to 72 hours depending on agency policy. Maximum you can keep the venflon 2 to 2.5 days. Do not let an IV bag or bottle of solution hang for more than 24 hours. If you see that without using the IV set or IV bottle hanging in your ward, please remove it immediately. So precautions for IV lines on insertion. IV line can cause so much of pain for the patient, and this gives a lot of discomfort for the client. Okay, so keeping the hand on the bed and without using the hand and connected with the IV line, IV bottle, and positioning and changing the position, these are also tedious for the patient. So better you give the better comfort to the patient and the patient having IV lines. All right, so here you can see a certain problem with IV line that shows some allergic response. So fluid sometimes may be overloaded. The fluid sometimes may be incompatible with the body fluid. Very young patients and very old patients should be taken care separately because the old person may have congestive cardiac failure, diabetes mellitus, hypertension, and renal disease, and many things they may have. So please be careful when you start the IV lines. This is about the complication. A nurse starting the IV fluids here. Complication shows the infection is more common, that shows by the fever, malaise, vomiting, and backache. These local signs shows the redness, swelling, then chills, headache, nausea, and tachycardia. These are all the signs. For the few patients, a patient might have phlebitis. If you keep the vent on more than 2 days or 3 days, that vein may get a phlebitis, that is inflammation of the vein, that is venous compartment. That shows by different signs and symptoms, that is heat, redness, tenderness at the site, and that swollen, hard, and intravenous infusion is actually goes sluggish. The fluid flow will be very, very slow and sluggish. So if you see that, immediately you should stop the IV fluids and remove the venflon and select another site. All right. Then thrombophlebitis is the hard and cord like a vein. Head that is hard and redness, tenderness at the site. Intravenous infusion will be very, very sluggish. So better remove the IV fluids. This shows some other complications too. So the local infiltration is common. Once the tip of the needle is out of the venu, then automatically that shows some local infiltration. Thereby showing some signs and symptoms of edema, pain, and the coolness in the site. May or may not have a blood return sometimes in the IV tubing. Then catheter embolism is uncommon actually. It is also a complication. The venflon is actually the plastic one. You have to remove the venflon within 2 to 3 days. Already I have instructed. If you fail to do that, sometimes the venflon cannula sometimes broken, and that passes through the vein, and that causes many problem for the patient. That is called catheter embolism. By showing the signs and symptoms of low blood pressure, pain along with the vein, weak and rapid pulse sometimes, cyanosis of nail beds, loss of consciousness. If you see these many symptoms with IV fluids, immediately you just stop the IV fluids and just inform to your doctors to take care of your patient further. All right. Okay. Next is about the circulatory overload. If you administer the IV fluid, sometimes the patient acceptance will be different. So the fluid may be overload for the patient. That shows by symptoms of increased blood pressure, distended jugular vein, rapid breathing, dyspnea, and moist cough and crackle. Other complications is electrolyte overloads, hematoma, and air embolism is also common. When you see the hematoma in the localized area, then by the symptoms of achinosis, immediate swelling and leakage of blood at the site, and hard and painful lump at the site, that is called hematoma. Air embolism is also common. When you keep the air in the tube, that may goes in and enter into the blood compartment, and that causes the air embolism. So by means of the symptoms of tachycardia, dyspnea, hypotension, cyanosis, decreased level of consciousness. When you see these many symptoms, immediately stop the IV fluids. These are all some complication in picturization. The first picture shows the infection. It is more tenderness, painful condition, redness also you can see. So stop the IV fluids. The second picture shows the phlebitis at the site of the IV venflon. So better stop the IV fluids. The third one is the thrombophlebitis. Already I have explained. Cord like a vein. You can feel it by your hand. If you touch it, you can feel the cord like a vein. That is thrombophlebitis. Immediately you should stop and start in another site. The fourth one is local infiltration. This is also with the infection. The fifth one is the hematoma formation. You can see the shiny skin and blackish blood accumulation on the skin. The final picture shows the air embolism inside the vessels that obstruct, and that creates a lot of trouble to the patient. Don't allow the air inside. The next chapter is actually about the central venous catheter. Let's see this chapter in the following video teaching. All right. So far we have completed the IV administrations, complications, the things which we require to start the IV fluids, do's and don'ts by the nurses,